The COVID-19 pandemic, also known as the coronavirus pandemic, is an ongoing pandemic of coronavirus disease 2019, COVID-19, caused by severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, first identified in December 2019 in Wuhan, China. The World Health Organization declared the outbreak a public health emergency of international concern in January 2020 and a pandemic in March 2020. As of November 18, 2020, more than 55.6 million cases have been confirmed, with more than 1.33 million deaths attributed to COVID-19. Common symptoms include fever, cough, fatigue, breathing difficulties, and loss of smell and taste. Complications may include pneumonia and acute respiratory distress syndrome. The incubation period is typically around 5 days but may range from 1 to 14 days. 12. There are several vaccine candidates in development, although none has completed clinical trials. There is no known specific antiviral medication, so primary treatment is currently symptomatic. 13. Recommended preventive measures include hand washing, covering one's mouth when sneezing or coughing, social distancing, wearing a face mask in public, ventilation and air filtering, disinfecting surfaces, and monitoring and self-isolation for people exposed or symptomatic. Authorities worldwide have responded by implementing travel restrictions, lockdowns, workplace hazard controls, and facility closures. Many places have also worked to increase testing capacity and trace contacts of the infected. The responses have caused global social and economic disruption, including the largest global recession since the Great Depression. 14. It has led to the postponement or cancellation of events, widespread supply shortages exacerbated by panic buying, famines affecting hundreds of millions of people, and decreased emissions of pollutants and greenhouse gases. Educational institutions have been partially or fully closed. Misinformation has circulated through social media and mass media. There have been incidents of xenophobia and discrimination against Chinese people and against those perceived as being Chinese or as being from areas with high infection rates. 15. MW parser output. Took limit 2. Took level 1 all, .mw parser output. Took limit 3. Took level 2 all, .mw parser output. Took limit 4. Took level 3 all, .mw parser output. Took limit 5. Took level 4 all, .mw parser output. Took limit 6. Took level 5 all, .mw parser output. Took limit 7. Took level 6 all, display none. Although it is still unknown exactly where the outbreak first started, several early infected people had visited Huanan Seafood Wholesale Market, located in Wuhan, Hubei, China. 16. On February 11, 2020, the World Health Organization, WHO, named the disease COVID-19, which is short for coronavirus disease 2019. 1718. The virus that caused the outbreak is known as severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, a newly discovered virus closely related to bat coronaviruses, 19, pangolin coronaviruses, 2021, and SARS-CoV. 22. The scientific consensus is that COVID-19 has a natural origin. 2324. The probable bat-to-human infection may have been among people processing bat carcasses and guano in the production of traditional Chinese medicines. 25. The earliest known person with symptoms was later discovered to have fallen ill on December 1, 2019, and that person did not have visible connections with the later wet market cluster. 2627. Of the early cluster of cases reported that month, 2/3 were found to have a link with the market. 282930. There are several theories about when and where the very first case, the so-called patient zero, originated. 31. On March 13, 2020, an unverified report from the South China Morning Post, SCMP, suggested a case traced back to November 17, 2019, a 55-year-old person from Hubei, may have been the first person infected. 3233. A growing body of evidence from Italy, France, and Wuhan, China has indicated the pandemic predated the December 2019 Huanan Seafood Wholesale Market outbreak. Phylogenic estimates in genetic studies conducted in early 2020 indicate that SARS-CoV-2 likely passed on to humans sometime between October 6, 2019 and December 11, 2019. 4. Satellite imagery from 6 hospitals in Wuhan indicated a steep increase in vehicle traffic starting in August 2019. 34. Concurrent with these results, elevated levels of internet search queries for the terms diarrhea and cough, both symptoms associated with COVID-19, were noted in the Wuhan area. 34. Retroactive molecular analysis of wastewater from the Italian cities of Milan and Turin found evidence of COVID-19 as early as December 18, 2019, indicating community spread was occurring prior to that finding. 35. Retroactive analysis of blood samples from 959 asymptomatic individuals enrolled in a lung cancer screening trial in Italy between September 2019 and March 2020 identified SARS-CoV-2 antibodies in 111 samples, 11.6% of the total, including samples taken as early as September 2019. 36-37. Doctors in Paris, France retroactively tested stored samples from a man hospitalized in late December 2019 and found he was positive for COVID-19. The man had no recent history of travel, which indicated community spread was occurring in Paris in December 2019. 38. Official case counts refer to the number of people who have been tested for COVID-19 and whose test has been confirmed positive according to official protocols. 39-40. Many countries, early on, had official policies to not test those with only mild symptoms. 41-42. An analysis of the early phase of the outbreak up to 23 January estimated 86% of COVID-19 infections had not been detected, and that these undocumented infections were the source for 79% of documented cases. 43. Several other studies, using a variety of methods, have estimated that numbers of infections in many countries are likely to be considerably greater than the reported cases. 44-45. On April 9, 2020, preliminary results found that 15% of people tested in Ganjult, the center of a major infection cluster in Germany, tested positive for antibodies. 46. Screening for COVID-19 in pregnant women in New York City, and blood donors in the Netherlands, has also found rates of positive antibody tests that may indicate more infections than reported. 47-48. Seroprevalence-based estimates are conservative, as some studies shown that persons with mild symptoms do not have detectable antibodies. 49. Some results, such as the Ganjult study, have received substantial press coverage without first passing through peer review. 50. Analysis by age in China indicates that a relatively low proportion of cases occur in individuals under 20. 51. It was not clear whether this was because young people were less likely to be infected, or less likely to develop serious symptoms and seek medical attention and be tested. 52. A retrospective cohort study in China found that children and adults were just as likely to be infected. 53. Initial estimates of the basic reproduction number, R0, for COVID-19 in January were between 1.4 and 2.5, 54, but a subsequent analysis concluded that it may be about 5.7, with a 95% confidence interval of 3.8 to 8.9. 55. R0 can vary across populations and is not to be confused with the effective reproduction number, commonly just called R, which takes into account effects such as social distancing and herd immunity. By mid-May 2020, the effective R was close to or below 1.0 in many countries, meaning the spread of the disease in these areas at that time was stable or decreasing. 56. Epidemic curve of daily new cases of COVID-19, 7-day rolling average, by continent.